A few moments later.
Michael, are you okay? You look very exhausted. Sure.
I cannot sleep. I thought it was due to my recipe. Just now I have eaten camarón, but it won't help. I still cannot sleep.
Actually, I got this one medicine. My doctor gave me last week. The name is alprazolam, and I already take it. It helped me to sleep. Yeah, very well.
Doctor, please leave my cousin here. He's having a hard time breathing.
Did you know that opioids are commonly used for pain management? They are especially helpful for post-surgical patients, cancer patients in palliative care, and people with severe injury or trauma. But how do they actually work? Opioids mainly act on something called the mu opioid receptor, MOR, and these receptors are mostly found in your central nervous system. Okay, so let's break it down. At your presynaptic neuron, normally when an axial potential arrives, calcium channels open, allowing calcium to enter the neuron and trigger the release of neurotransmitters like substance P and glutamate, which send pain signals. But when opioids are present, they will bind to MOR, and this will block your calcium channels, stopping the release of those neurotransmitters. Next, at your postsynaptic neuron, opioids open potassium channels, causing potassium to flow out. This leads to hyperpolarization, which means the neuron becomes more negative inside, making it harder to reach the threshold to fire an action potential. As a result of both actions, the transmission of pain signals is reduced, leading to pain relief. So, activating opioids receptors causes wakefulness, which explains why opioids can make you feel sleepy. But bear in mind, opioids also have harmful side effects, one of the most serious being respiratory depression. In the brainstem, we have a region called the pre-Burt-Zinger complex, which is crucial for generating and regulating your breathing rhythms. When opioids bind to the receptor in this area, they suppress the neurons responsible for controlling normal breathing. This can lead to slow breathing, and in severe cases, even respiratory arrest. So while opioids are powerful for pain relief, they must be used with caution. Opioids aren't the only ones affecting your brain. Now, let's talk about another class of drugs that also slows down your brain activity, benzodiazepines. Have you ever wondered how medication like benzodiazepines calm people down? So, in our brain, there's a natural chemical known as GABA. It's an inhibitory neurotransmitter and it acts like your body's built-in brake system. When we feel stressed, GABA slows down the brain activity to allow us to relax and sleep. GABA works by binding to its receptor, known as GABA-A receptor at the postsynaptic neuron, which can be found in your central nervous system. This receptor consists of 5 subunits. As you can see in the image, there are 2 alpha, 2 beta, and 1 gamma. These subunits arrange to form a central chloride channel that opens to allow chloride ions into the neuron. This leads to hyperpolarization of the neuron, which means the inside of the neuron becomes more negative, making it less likely to fire. Hence, neuron will become less responsive to another neurotransmitter like your norepinephrine, your serotonin, your acetylcholine, and your dopamine. But where does GABA bind to? Based on the image given, alpha and beta subunit form the receptor site, which allow GABA to bind. Now, here comes the next question. What are benzodiazepines and how does it bind? Benzodiazepines act like a booster. They enhance the activity of GABA. Benzodiazepines bind to specific allosteric site, which is located between your alpha and gamma subunit. They do not directly activate the receptor, instead, they enhance GABA at the GABA-A receptor. This allows more chloride channel to open and more influx of chloride ions, making the neurons to be more hyperpolarized, since there are more chloride ions flowing in. This gives you the sedative and anti-anxiety effects. How cool it is! However, there's something to take note of while using it. Since it slows down your brain activity, it will also affect your respiratory center, which involves in rhythmic breathing and sensitivity to carbon dioxide. However, don't worry, using benzodiazepines alone usually does not cause any breathing issues unless you are taking other medications like opioids. But why taking these 2 medicines together lead to respiratory suppression? Okay, so let's break down how they work synergistically. Benzodiazepines boost GABA, It is your brain's natural break which makes you feel relaxed, sleepy, and less anxious. Opioids, like morphine or oxycodone, block pain but also slows down your brain respiratory center. So, if both are taken concurrently, their effects stack up. That's why doctors and pharmacists always warn, do not mix benzodiazepines and opioids without medical advice. The combination can be dangerous or even fatal. Both drugs are central nervous system depressants. This means they both slows down your brain and body functions.
Are you okay, Michael? Michael?
When combined, these drugs intensify sedation, leaving you feeling confused, dizzy, and even unable to move properly. These side effects can lead to dangerous falls and accidents. Even more concerning is respiratory depression. Both drugs can slow your breathing to dangerously low levels, which may lead to breathing failure or even unresponsiveness.
Hello? Hello? Is this 999? I need help now. My friend can breathe.
Oh my god, doctor, I didn't know this condition had become like that.
So you should be more careful with your cousin's medication in the future, especially when he's taking other medications at the same time.
I should have been more cautious. I've heard using both opioids and benzodiazepines can slow down your breathing, but I didn't realize how serious it is.
Exactly. They can cause synergistic CNS depression, which, when taken together, they can actually further suppress your respiratory system. And that means your breathing can actually slow down to the point where it becomes too shallow, and eventually it could stop breathing altogether.
Wait, so you could actually stop breathing?
Well, it all comes down to how the drugs are processed in your body. So both opioids and benzos actually metabolize by the same enzyme in the liver, which is called the CYP3A4 enzyme. And when you take these two drugs together, they can end up accumulating in the system and cause toxicity effects.
So they are kind of competing with each other to be broken down?
Exactly. And because of that, they can accumulate to toxic levels, and this is especially risky when taken with drugs like fentanyl and midazolam, where even small doses can be very fatal if not carefully monitored.
Wow, so the combination can be really dangerous, right?
Yes, and that's why it's crucial to never mix opioids and benzodiazepines together without the direct medical advice, as this can risk fatal respiratory depression in patients.
From 2019 to 2020, benzodiazepines overdoses with opioid among emergency department visits increased by 34.4%. Opioids involvement with benzodiazepines causes 92.7% death cases, while 66.7% death cases involve illicit usage of benzodiazepines. The data above shows a concerning trend of non-fatal and fatal overdosing involving benzodiazepines and opioids. This may be due to illicit benzodiazepines like alprazolam, alprazolam, and fluorobrazolam. Supply increased among post-mortem and clinical samples in 2020. In 2016, public health officials urged the FDA to act on a deadly trend, the combined use of opioids and benzodiazepines. From 2004 to 2011, emergency room visits and overdose deaths from these medications nearly tripled. In just a decade, more than 2.5 million additional patients were prescribed both medications. Today, the FDA issues its strongest warning, a box warning, alerting users to the danger: extreme drowsiness, slow breathing, coma, and even death. To help reach both healthcare professionals and the public, the FDA has issued a drug safety communication outlining the serious risk of using opioids and benzodiazepines together. Patient medication guides are now required, urging everyone to understand this risk and for providers to prescribe them cautiously and only when absolutely necessary. We are in a health crisis. Mixing opioids and benzodiazepines is causing overdose epidemic around the world. This is happening in Malaysia too. These drugs are still sometimes given together, especially to people with long-term pain, and it's a growing concern. When used together, drugs like oxycodone and diazepam can slow down your body, your breathing, your brain, and that can be deadly. Some illegal drugs are mixed with benzodiazepines without people knowing. That makes the risk of overdose even higher, but there's help. Pharmacists are on the front lines. They check your medications, warn you about risk, and talk to your doctor if needed. By staying alert and taking action, pharmacists can help stop this preventable death. Our message is clear. Mixing opioids and benzodiazepines isn't just dangerous. That combination can stop your breathing for good. Even prescribed together, they are high risk. The FDA is warning everyone, this isn't something to mess with. Talk to your doctor or pharmacist. Read the guide. And if you are mixing these medicines,
Don't mix. Don't mix.